Wetting yourself is not okay. It is not okay to wet yourself. It is something that you can change. I hear lots of mums joking and laughing about wetting themselves after kids, or that they feel like they can't run down the street. And it's regardless of whatever ages your kids are. So I've got lots of mums that their kids are grown up and they, still go, oh, I wet myself, but I've had kids, so that's normal. It's not normal, and it can be changed. It's also not something that we should accept, because as you get older, the lining gets thinner. So there is a lining there, and the lining gets thinner, and you are going to be more inclined to have more pelvic floor problems or incontinence issues if you are ignoring this. So get onto it straight away as soon as you can. And it is really, really important. So what I would recommend to do is that if you are a new mum, if you're a mum that does find, regardless of where your kids are, what ages your kids are, if you find you are wetting yourself, then go and seek help from a pelvic floor physio. So you need to firstly go to a pelvic floor physio to see where your pelvic floor is at, because we are all different, and we're all at different levels. So some people is overactive, other people's is underactive. So you need to work out where your pelvic floor is at before you can start doing exercises in order to help it. So for me, my pelvic floor was actually, after I had my second baby, my pelvic floor was too tight. So it was too tight, which meant it wasn't switching on, which meant as soon as I started running, I was wetting myself. And as much as I didn't want it to be that way, it just was, but I knew that I needed to work on it straight away. So it meant I couldn't run for another 6 months or so, which I was devastated about, but it is what it is. I couldn't run for another 6 months, and I actually had to work on loosening my pelvic floor. So I had to learn on kind of unwinding everything and then switching it on properly. And I run with no problems now. I have no pelvic floor issues, and I see mums with kids the same ages that are still having pelvic floor issues because they didn't do the work straight away. So please, if you do have a pelvic floor problem, get it seen to straight away. Once you know where your pelvic floor is at, then we can do exercises to be working on strengthening. Strengthening your core all starts from your pelvic floor. So we need to learn how to switch your pelvic floor on first, and then your core. So but we need to know where it's at before you get started. Now I meet lots of mums and they'll come in and be, no, I'm fine. It doesn't matter. But if you are somebody that has never had it checked, I highly recommend to go get it checked. If you are somebody that's had kids close together, your kids are close together, you've probably hasn't given, again, not your fault, not given your pelvic floor enough time to rebuild that strength up between babies or between pregnancies. Also, if you are someone that's older, I've had older women, and again, it's something that they don't talk about very often, because it's maybe embarrassing, but I've had older women come up and saying, oh yeah, I have this problem. But the thing is, you can change it. So even if your kids are in their 20s, 30s, whatever, you can still change it. And I have trained people, and we have been able to fix those issues. I had a lady that she was unable to, when she was going out walking, she had to stop all the time to go to the toilet because she always was worried, she wasn't going to be able to hold it in. And she did my core program, and we were able to, actually, she doesn't have that problem anymore. So the same thing, it's just not something you accept. If you look, again, it's things that you can manage now. So you can manage it now while you're younger, but I want you to start thinking about, how would this be when I get older? The lining gets thinner and it becomes more of a problem. And remember, that gets thinner. And so as an elderly person, the elderly people in my life, they are scared to go too far away from the toilet. So it affects their quality of life because they don't want to go too far because they know they can't hold on. So it might be something that we laugh and joke about now, but it's something that you can prevent, and it will really, really have a huge influence on your life when you get older. The other thing is, that remember that the pelvic floor, it's all linked to your pelvic floor, and going to the toilet, you're going to do poos, they're all linked. So, if your pelvic floor is weak, you can have trouble at the other end as well. So again, it's just not something that you want to be. You want to have, but you can change it. You can change all of this and you can take charge of it. And that's what I want you to do. So do not accept wetting yourself. Do not accept, that if you jump, you wet yourself, you run, you laugh. It is not something to accept or to make jokes about, because you can change it. And I urge you to start doing it now, because as you get older, it will become more of a hindrance and more than what you believe. So speak to anybody older around you and ask them how it is. And in this day of age, we want to send the message out that it is not something to accept and you can change it. So take charge.